Last night, National Drug Authority, through intelligence-led surveillance and operation, arrested one Kibalya Ronald Nditusawa, who was in unlawful possession of government drugs. These are ARVs, totaling to 720 tins that amount to 64,800 doses. Mr. Nditusawa, who works with Kamuli Hospital, was arrested together with his enablers, including Mwesigwa Moses, Mumbere Godfrey, and Bwambale Walter. These were moving and delivering the 12 boxes of ARVs in a private saloon car, registration number UBN 848Y, a Toyota Primo, and these were delivering them at one of the hotels in Nansana municipality, Wakiso District, before our surveillance team raided and got hold of them. The suspects are currently being held at CPS in Kampala under CRB number 1020 of 2024, and their file has been submitted to the state for prosecution. They've been charged with two accounts. One, unlawfully possessing classified drugs, contrary to section 27(2) of the National Drug Policy and Authority Act, Cap 198, and count 2, unlawful possession of government stores, contrary to section 296 2 of the Penal Code, Cap 128. This is part of NDA's crackdown on the safety of government of drugs, a mandate that has been extended to National Drug Authority by both Cabinet and Ministry of Health to ensure that we stop and bring to an end the stealing of government stores. And these, from our experience, have been in the hands of the people like Mr. Nditusawa, who work in government hospitals and use the advantaged position to deprive Ugandans of these much needed and highly expensive drugs. ARVs mainly are donated by development partners, but they are high value drugs. Within just this year alone, since March 2024, NDA, through these kind of operations, we've been able to recover government of drugs, mainly ARVs and antimalarials, worth over 2.5 billion Uganda shillings. So we call upon Ugandans to remain vigilant and report to us any suspicion of these kinds, because these deprive, you can imagine, just only this capture depriving over 64,000 Ugandans to access these drugs. And of course, they are selling them at a much cheaper price, taking them out of the country. We have intelligence information that these end up in Southern Sudan and Congo, where they are sold at premium. Of course, such deprive Ugandans access to the drugs that they need. And when you don't get the drugs, it means you cannot get the treatment that is needed, and you become less productive. And of course, some end up losing their lives. So we call upon Ugandans to take this as not only a drug issue, but it's an economic and security issue that we need to work together to bring to an end.
Can you give us the
CRC have been were allocated. For now, we want to work with the ministry to find out where these were allocated, but we know for sure that Kibalya Ronald Nditusawa works with Kamuli Hospital. Chances are that all these were coming from Kamuli Hospital. 12 boxes, all of them were still sealed. 720. A dose of ARVs, even when the government of Uganda doesn't buy and come from the development partners, is valued between 200 to 250,000 Uganda shillings. These are very high value drugs. So the value of this is over 300 millions. And just like I mentioned, just in 1 year alone, we've been able to recover over 2.5 billion worth of stolen government drugs.